Hi, my name is Gabby Brown. I'm a physician assistant student. How are you doing today?
I'm good.
What's your name?
Sharina.
Sharina. And what's your birth date, Sharina?
September 26, 1995.
And why are you here today?
So I've been having some itchiness in my eye, and sometimes I just start tearing, and it's only the one eye, so I've been kind of concerned because I don't know what's happening to it.
Okay, and which eye is giving you?
It's my right eye.
Right eye?
Mm-hmm.
Okay. And then when did these symptoms start?
About 2 days ago.
About 2 days ago. Okay, and have you noticed that anything makes it worse?
No, I mean sometimes in the morning it's a little bit worse, or if I go outside, but other than that it's pretty much fine.
Okay, and does anything make it better?
No.
No, I'm sorry to hear that. Did anything happen when this started? Any event that you can remember, or?
No. I went hiking like a week ago, but no, nothing fell in my eye or anything because I feel like that would have been more sudden. So
Okay.
it's the only thing I remember.
Okay, and then has this ever happened before?
No.
No, this hasn't happened before. Has it gotten worse throughout the day, or is it better, or no change?
No change.
No change. And then, can you describe it for me? Is it?
Well, the tearing is just kind of annoying because it's like too much that's just coming out.
Mm-hmm.
And then the itchiness, I don't know how to, I can't scratch my eye, so it's just uncomfortable, and I have to constantly keep blinking, and it hurts.
Okay. How would you rate your pain on a scale from 1 to 10, 10 being the worst pain you've ever had?
Probably a 3. It's more uncomfortable than pain.
More uncomfortable.
Mm-hmm.
Okay. And then, has it been constant for the past 2 days, or has it come and gone?
It's been constant.
It's been pretty constant. Okay. And then, other than the tearing and the itchiness, do you have any other symptoms? Is there anything else that you've noticed with that eye?
Nothing.
No.
Mm-mm.
Okay. Are you currently taking any medications?
No.
How about any oral vitamins?
I take a multivitamin.
Multivitamin. Okay. Any minerals or supplements?
Nope.
Any over-the-counter stuff?
No.
No. Okay.
I tried some eye drops for it, but it didn't help. They're just redness eye drops and itchiness. It didn't help.
Okay. How many times did you try those eye drops?
Twice.
Tried them twice.
2 different days.
2 different days. Okay, and they did not help. Do you have any allergies?
I have seasonal allergies.
Okay.
Sometimes when I go outside.
Do you notice a certain season that they're worse in?
Spring.
Spring.
Right when it changes from winter to spring, that's when it usually hits all.
Yeah. Oh, that's terrible. So I'm going to ask you some questions about your childhood history, your adult history, just so we can get a better background, so we can kind of figure out what's going on.
Okay.
Have you ever had any childhood illness, like measles?
No.
Mumps?
No.
Rubella?
Mm-mm.
Whooping cough?
No.
Chickenpox?
Nope.
Rheumatic fever?
Nope.
Scarlet fever?
Mm-mm.
Polio?
Nope.
Diphtheria?
Mm-mm.
Varicella?
Nope.
Did you have any chronic ear infections as a child?
No.
No. Have you gotten your vaccinations for some of the ones that I listed?
Yeah, I think I've had pretty much vaccination for all of those.
Okay, awesome. And then with your health right now, have you been diagnosed with anything such as hypertension?
Nope.
Diabetes?
Nope.
Hepatitis?
Nope.
Asthma or COPD?
Mm-mm.
HIV?
Nope.
Thyroid disorders?
Mm-mm.
Anything with your heart?
Nope.
Like angina? No. Cancer?
Nope.
Or kidney disease?
Mm-mm.
Have you ever had problems with clotting, like a deep vein thrombosis?
Mm-mm.
No? Okay. And then, do you see a gynecologist on a regular basis? Yes. When did you first get your period?
8th grade.
8th grade.
So I don't know what year that would be.
Okay.
2009.
Okay. And then, when was the date of your last period?
A week ago.
A week ago. Okay. And how would you describe your period?
It's pretty heavy, actually.
Okay. Do you know, like, can you give me maybe how many pads you use or tampons on a daily
Probably
basis?
3 to 4.
Okay.
Yeah.
And then have you ever been diagnosed with any psychiatric disorders?
Nope.
Just depression,
Mm-mm.
anxiety? No. Did you have any accidents or injuries?
Nope.
Have you had any hospitalizations?
Nope.
No. Have any past surgeries?
Nope.
Okay. Do you regularly get tests such as like colonoscopies or mammograms or pap smears?
Nope. I'm not 21 yet, so I haven't had a pap smear yet.
Okay. How about any TB tests?
Yes.
Yes,
I
TB
don't.
tests. Okay. Have you had blood work done recently?
Yes, I just got blood work probably a month ago.
Okay.
Okay, just move up a little.
And then, when did you get the TB test?
Same time, a month
Around
ago.
the same time.
Yeah,
Okay.
it was all for school.
I'm going to ask you a little bit about your family history, because a lot of diseases can run in family, or you could have a genetic predisposition to them. Can you tell me about your mother's health?
My mom, I think she had thyroid disease, or she had something with her, I'm not too sure what it is. But she had a treatment for that, and she's been fine since that.
Okay.
She has osteoporosis, and that's pretty much it. Besides that, she's pretty healthy.
That's good. How old is she?
53.
53. And then your father?
He is pretty healthy, actually. I don't really think he has anything. His blood pressure's good and everything, yeah.
Awesome. How old is he?
53.
53.
Mhm.
Okay. Can you tell me about your mother's mother, so your grandmother?
She has diabetes.
Diabetes,
Mhm.
okay. And how old is she?
89.
And your mother's father?
He died from a heart attack, I believe, and I think he had heart disease. Or he had something
I'm very
wrong.
sorry to hear that. Do you know around what age he was when he passed away?
It's 50 something?
50.
Yeah, that's pretty young.
Okay, how about your dad's mother?
I don't think anything runs on that side of the family. I don't think she has anything.
Okay. Do you know about how old she is?
84?
84.
Yeah, 84, 85.
Alright. And then his father?
I don't think he had anything either.
Okay. Do you know about how old he is as well?
He passed away about 20 years ago.
I'm sorry to hear that.
Oh, thank you.
Alright, now I'm going to ask a little bit about your social history, just so we can get an idea of what you do on a daily basis. What would you consider your ethnicity?
Indian.
Where were you born?
Queens, New York.
How would you describe your childhood?
I was pretty active. I like to do things. Pretty normal. I don't think I played a lot of sports, maybe. I played 2 sports. That's not really a lot, but...
That can be a lot. What is the highest level of education?
So I completed well, technically I'm still getting my master's, so just still a student.
Okay. And who are you living with right now?
I'm living with my 3 roommates, and then while I'm on campus, and then at home I live with my parents.
Do you have any siblings?
Yes, I have an older brother.
How old is he?
He's 23.
And then with your roommates here, what kind of living situation is it? Do you live in an apartment, house?
It's a house.
A house.
Mhm.
Do you have any pets?
Yes, we have a cat.
What term would you use to define your relationship?
Single.
Single?
Very single. It's good though, because school's a lot right now, so I don't have time for that.
Yeah. Yeah. So this is something that I'm required to ask all my patients to better educate them about STIs and everything.
Okay.
But are you currently sexually active with men, women, or both?
No.
Do you have any questions about your sexuality, your sexual orientation, or any sexual desires you'd like to discuss? Have you ever been diagnosed with an STI?
No.
Do you experience any discomfort or pain during sex?
Mm-mm.
Is there anything you'd like to talk about regarding your sexual functioning?
Nope.
What's your current financial situation?
I mean, my parents support me, but I also have a job. I work about 6 to 7 hours a week.
Oh, wow. Where do you work?
I work at our student center. So I just I answer questions and do little tasks, but I could do homework there, so that's basically why I'm still working there.
That's nice.
I get some things done and get paid at the same time.
That's really nice. Have you ever been part of the military?
No.
What do you do for fun, fun activities?
I like to hang out with my friends. I think just this year I'm just looking to relax and do anything, and I think I want to go in the city more because I lived here for 4 years and I've probably been to the city about a total of 7 times.
Yeah,
so,
it's hard to get into the city.
Yeah, and I kind of want to do that more, so.
Okay, cool. What would you consider your baseline of function? So on an everyday basis, are you able to dress yourself, eat, make yourself food?
Yeah, I'm pretty much able to do everything by myself.
Okay. And then what is your religion or your belief system?
So I'm Hinduism. Well, I'm a Hindu, but very religious, very strong religious beliefs. I think that it's a good support system, and it's good with school and everything. And we have a small gathering on campus too. So
that's nice. How would you describe your daily meals?
An average meal. So breakfast, I'll have cereal or yogurt. For lunch, I'll maybe have some salad or pasta or something. And then for dinner, maybe pasta or tacos or just something. Dinner is usually my favorite meal, so I like to go all out for that.
How much do you exercise? How often?
3 to maybe 4 times a week.
And what do you do for exercise?
Go to the gym, I'll do some cardio. I don't lift that much. But as long as I'm making my way there, it feels like a lot.
Yeah,
so.
Yeah. How much do you drink a day? How much water?
About 64 ounces.
And do you drink any caffeine throughout the day?
No, I'll probably have caffeine maybe once a week, if anything.
Oh, wow.
I don't really like caffeine. It gets me jittery.
Yeah, happen. Do you do any alternative healthcare practices? So examples would be natural products or breathing exercises, yoga.
No. My mom's really into that stuff though, so I know exactly what you're talking about.
And then do you take safety measures on a daily basis, such as wearing your seatbelt?
Yeah.
Do you have smoke detectors in your house?
Mm-hmm.
Using sunblock?
Yep.
How much do you smoke a day?
I don't smoke.
You don't smoke. And then how much do you drink a day, alcohol?
I don't drink every day, but if I do, it's on the weekends. Maybe 2 glasses of wine.
Okay. Have you ever taken any illicit drugs? Examples would be cocaine, marijuana, heroin, methamphetamines, opioids.
No.
No. Do you ever take any prescription medications when they're not prescribed?
No.
No. Okay. So the next part of this interview is going to feel like a long series of questions, but it's just so I can rule out anything that could possibly be happening.
Okay.
Have you experienced any changes in weight?
No.
Any difficulty eating?
No.
Any weakness?
No.
Any fatigue? So that's tired.
Yeah, but that's just because of school. I don't think it's...
Yeah. Have you had like a general feeling of being unwell?
No.
No. Any fever?
No.
Chills?
No.
Night sweats?
Mm-mm.
Have you noticed any rashes on your skin?
No.
Any lumps?
Nope.
Do you bruise easily?
I would say yeah.
Have you noticed that your skin is more pale than it normally is?
No.
Have you noticed any changes in size or shape of moles?
No.
Have you noticed any changes in the color or the texture of your skin?
Mm-mm.
Have you had any severe itching?
Nope.
Have you noticed any new stretch marks?
Nope.
Have you noticed any changes in the hair or your nails?
No.
Have you noticed any excessive dryness of your skin?
Mm-mm.
Any scaliness? Have you noticed any acne?
Mm-mm.
Any warmth in a certain area of your skin?
No.
Any lesions?
Nope.
Oiliness?
On my face, but probably just because I sweat a lot.
Have you noticed any changes in color? For example, like redness or...
No.
Have you noticed any sores?
No.
Have you had any headaches recently?
Yes.
Have you experienced any head trauma?
No.
Have you noticed any lesions on your head?
Not that I could see, but I don't think so.
Have you had any periods of time where you lost consciousness?
Not that I know of.
Okay. Have you been dizzy recently?
No.
Have you noticed any changes in your vision?
Well, this one, just because it's so uncomfortable.
Yeah.
So it's harder. And like my contacts, they get really dry and itchy, so I usually wear weekly ones, but I've had to change them every day because it just doesn't, they're irritable at the end of the day.
So you said you wear contacts.
Yeah.
Do you also wear glasses or just the contacts?
Just contacts. I have glasses, I just don't wear them.
Okay. When was your last eye exam?
Last December.
Have you noticed any double vision?
No.
Any pain other than you were saying that you had pain with the itchiness, right?
Yeah.
But just in the right eye?
Yeah,
not in the
no.
left? Okay. Have you noticed any like blind spots in your vision?
No.
Any sensitivity to light?
No.
And you said that you had a lot of excessive tearing. Do you have any
Yeah.
other discharge that comes out of the eye?
It's like maybe like a little white sometimes. I don't really know what it is. Sometimes it just looks like kind of like the little like crunchy things that you have in the corner of your eye when you wake up.
Okay.
But it was looking like tears usually like clear. It was like little white.
Yeah. Do you notice it when you wake up?
Yeah. Sometimes the one day I noticed it like in the middle of the day though. But that was the first time I saw that.
Okay.
That was 2 days ago, I think.
Do you have any redness of the surrounding of your eye or even like the white part of your eye? Have you noticed any?
Just like a little bit around this one, I think.
Okay. Did you have any recent eye trauma?
Mm-mm.
Have you had any eye surgeries recently?
No.
Do you have any blurred vision?
Just in this one.
Just in
Yeah.
this one? Yeah. And now is that just with the tears or is that constant blurred vision?
No, it's just because I try to blink more because it's so like uncomfortable, and then like my contact gets out of vision, so I think that might be why.
Okay.
I'm not sure.
Have you noticed any temporary loss in vision or like any like areas that you can't see?
No, I haven't really noticed anything.
Have you noticed any spots or specks in your vision?
No.
Flashes of light?
Mm-mm.
Okay. Have you noticed any decreased hearing?
Mm-mm.
Do you use any hearing aids?
No.
Have you had any earaches recently?
No.
Any discharge?
No.
Have you had past ear infections?
I had one like years ago.
Okay. Have you ever had any vertigo?
What is?
Vertigo is a condition in which you constantly feel dizzy
Oh
when
no.
you're sitting. No. So you've never had any
No.
dizziness either.
Mm-mm.
Okay. Have you ever had any ringing in your ear?
No.
Any trauma to your ears?
No.
Any lesions?
Nope.
No. Have you ever had frequent nosebleeds?
No.
Frequent colds?
No.
Any sinus problems?
Mm-mm.
Any discharge?
Mm-mm.
Frequent sneezing?
No.
Loss of smell?
Mm-mm.
Is your nose congested?
Yeah. Oh, no.
No.
I had to feel it.
Yeah.
I was
Have you noticed any severe itching of your nose?
no.
No. And have you ever been diagnosed with hay fever?
No. Not that I know. I've never heard of that, so hoping not.
Have you ever had any conditions with your teeth or gums?
Mm-mm.
When was your last dental visit?
This summer, so like July,
Okay.
June.